Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. And if you didn't already know, Bambu Care is home to the Treehouse, which is an all-in-one dementia care resource and education platform for dementia caregivers. So if you're interested in learning more about how our platform can help support you on your dementia care journey, you can check it out at letsbamboo.com/treehouse, okay? Before we get started, I also wanted to let you know about our 2024 holiday giveaway. We are super excited to be giving away some of our products, and if you'd like to learn more about what they are and enter for a chance to win, you can go to letsbamboo.link/giveaway. The link will also be in the podcast notes for you as well. The giveaway closes on Sunday, November 17th, 2024 at 11:59 p.m. Central Standard Time, okay? So good luck to everyone that enters. So today we're going to be talking about a lesser talked about condition that some people with dementia will experience, and that is prosopagnosia. So not everyone with dementia will experience this, but some will, okay? So what is prosopagnosia? Prosopagnosia is just a fancy term for face blindness, meaning it can make it difficult for a person with dementia to recognize familiar faces, including those of their family members, friends, or even themselves. So in this case, it's not a memory issue or an issue of time perception, meaning if your partner has prosopagnosia, their inability to recognize your face is not because they don't remember you or are having trouble placing you on their timeline. Prosopagnosia specifically stems from impaired face processing abilities due to damage in the areas of the brain that handle visual recognition. This condition prevents the brain from recognizing or recalling faces visually. So a person with dementia who has prosopagnosia may know who you are in a factual sense and remember your relationship to them, but they will struggle to identify you when they see your face. Therefore, instead, they might rely on other clues like voice, scent, the way you walk, or some other context to recognize you, okay? So let's talk about some signs that your partner may be experiencing prosopagnosia. I'll give you 6, okay? 1 is difficulty recognizing close family members or friends. So they may struggle to identify even close family members or friends, which can lead to hesitation or confusion when approached by familiar people. So they might ask, "Who are you?" even if they've known the person for many, many years. 2 is distress or frustration around social settings. So they may feel uncomfortable or anxious in group settings, even with familiar people, because they're unable to recognize who is around them. This may lead them to withdrawing from gatherings or social activities. 3 is reliance on non-visual cues for identification. So they may recognize someone by their voice, clothing, scent, or distinctive features rather than by their face. For example, they might identify a family member by the sound of their voice or footsteps, or by a particular perfume or cologne rather than facial features. 4 is difficulty following visual media with multiple characters, so watching TV shows, movies, or even looking at family photo albums can become confusing, as they may struggle to differentiate or remember individual faces. So they may frequently ask who a character is or lose track of storylines involving multiple people. 5 is mistaking people for each other or strangers. So they might confuse people with similar appearances, such as mistaking a daughter for a spouse or nurse, or believing someone familiar is a stranger. And this can be particularly common when a caregiver, friend, or family member changes their appearance, like a haircut or dyeing their hair, or trying a new style of clothing. For example, someone who always wears a shirt and pants starts wearing dresses all of a sudden. And then 6 is showing distress or frustration when asked to identify people. So they may express distress, frustration, embarrassment if asked to identify someone, especially if they feel pressured or are aware of their difficulty. Now, some individuals may try to cover up their recognition difficulties by just nodding along or just going with it without truly recognizing others, okay? So, whatever you say, sure, right? So, what can you do as a caregiver to help your partner? Well, first, if your partner has difficulty recognizing people, you want to start by introducing yourself each time and encourage others to introduce themselves as well. Or, if you're around, you can introduce them yourself. There is absolutely no need to play the guessing game. In certain situations, like visits to a care facility, it may even be helpful to wear a name tag to make it easier for them. Another tip is to keep your hairstyle, hair color, and even your scent consistent. Now, if you want to change things up, that's fine. Just let them know, especially if it's something that they use to recognize you. For example, you might say, "Hey mom, it's Pam. I decided to cut my hair. What do you think?" You can also wear clothes or accessories that the person associates with you. For example, a piece of jewelry like a watch, bracelet, or necklace. Also, remember to use your normal voice when talking to your partner. Now, I know this may sound a bit odd, but sometimes people shift to a higher pitched or baby talk tone, also known as elder speak, when they are talking to someone with dementia. So you want to try to avoid this, okay? And then, most importantly, you want to avoid drawing attention to any recognition struggles. As I mentioned, there is no need to play the guessing game. So you want to avoid questions like, "Do you remember who I am?" Or saying things like, "You don't know who that is?" Or, "Come on, you know them." Now, if they want to guess, that's perfectly fine, but let them initiate it. Don't force it upon them, okay? But that is all for today's episode. I hope this gave you some insight into what prosopagnosia is, how it can impact those who experience it, and how you can better support your partner. Also, if you enjoy our podcast, please be sure to leave us a good review. It really helps others find our podcast, and we really appreciate your help. If you have any questions, comments, or future podcast requests, you can send us an email at podcast@whatthedementia.com or contact us through our website at letsbamboo.com. And of course, if you're listening to this on Spotify or YouTube, you also have the option to leave a comment. Thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.